But this event is organized by Youth Rise in collaboration with Women in Harm Reduction International Network, and also co-sponsored by our friends at Students for Sensible Drug Policy International. And we are also delighted to have the support of the Norwegian delegation for this event, which we think is very important. This session on young women who use drugs was inspired by a joint position paper that we published last year with Women in Harm Reduction International Network, that was developed by a working group of young women with lived and living experience of drug use, which we are going to drop the link for in the chat. So we would appreciate if you would take a look at that position paper, but we are going to talk more about that as well today. And before we start, I would just like to say a few words on behalf of Youth Rise, express our solidarity with our colleagues, friends, and the community of people who use drugs in Ukraine, who are facing unacceptable levels of violence, repression, hostility, and a devastating humanitarian crisis. Throughout this week at CND, we heard a lot of strong statements by member states, which we appreciate. But in this context of event about young women who use drugs, who are a population that rarely gets talked about, we wanted to highlight that we are saddened and quite upset to see the lack of focus and mention of people who use drugs and other key populations in the context of the Ukraine, the situation in Ukraine. As you know, these populations are at highly increased risk in any conflict situation and humanitarian crisis, and we are very concerned about our friends and the community of people who use drugs in Ukraine, as well as in Russia and Belarus, who are without access to crucial life-saving health treatment and harm reduction services at the moment. Several opioid agonist treatment clinics and facilities have been compromised in the conflict already, as well as other critical health infrastructure. And as you know, the humanitarian corridor is also constantly threatened, which is putting our friends and the community of people who use drugs in a critical situation with regard to danger to their health. Our friends at the Eurasian Harm Reduction Association are running a crowdfunding campaign at the moment in direct contact with an organization of people who use drugs in Ukraine, who are bravely continuing to provide services in this situation. And we are also going to share the details to this fundraiser in the chat. So if you are in the position to do so, we and EHRA would appreciate support, as this is our best way of supporting people who use drugs in Ukraine at the moment. So thank you for giving me the space to say that, I guess. But yeah, we thought this was important to highlight because today's event is about young women who use drugs, and our community is one that is rarely talked about, and our challenges are rarely specifically addressed in forums, especially forums like the CND. So we are very excited to break the silence today, and I'm probably going to say this a couple of times today, but we have an amazing panel made up entirely of young women who use drugs, which we also think is a first at CND. So yeah, we are very excited. I think we're going to have a great discussion today. So without further ado, I would like to introduce our first panelist, who is Ruby. Ruby Lawler is currently the International Communications Officer of Youth Rise, and she also works with the Uganda Harm Reduction Network. Ruby will introduce the position paper that I already mentioned that we published last year, and she will also outline the main challenges that came up in the process and were identified in the paper itself. Ruby, you have the floor.
Thank you so much, Trixie. Can everyone hear me okay? First, I need to check. This laptop is tricky. Let me not move my head, because that seems to be when the problem comes. Okay, so hi everyone, and thank you so much for coming today. I'm delighted to see so many people ready to break the silence with us about young women who use drugs, the challenges we face, and the recommendations that we have. This year at CND, there is a number of side events about women involved in the drug trade and production and women who use drugs, but so far nothing on the specific challenges that young women who use drugs face. This was the reason behind why we at Youth Rise joined forces with the Women in Harm Reduction International Network in 2021 to create a position paper that identifies the lack of data and the challenges faced by young women who use drugs. The first thing we noted in the creation of this position paper was that we wanted it to be about specifically young women who use drugs. We came together as young women who use drugs and advocates for drug policy reform and harm reduction promotion, and some also working in harm reduction provision. When we were putting together the topics and doing some base research for this position paper, we met challenges in identifying the key issues that young women who use drugs face in the literature that we were using, due to the severe lack of data on this population specifically. We were looking not for data on just young people or women who use drugs, both which already face a significant lack of data and research base already. This lack of data and research on young women who use drugs can be felt by us all around the world. It aids in keeping the punitive drug policies in place, ensuring that young women who use drugs are left behind in development. Sorry, the dogs. Can you hear me? Okay. And it means that the policymakers and service providers are not aware of our nuanced needs and specific challenges due to our compounded stigma and discrimination of both gender and age-related factors. I'm coming from the perspective of a young woman who uses drugs, who has lived in both the global north and the global south. I'm not any expert on life as a woman who uses drugs in the global south, and I don't want to claim to be. My experience and knowledge on this topic in the global south context comes from working in the only harm reduction service available here in Uganda. I'm originally from Ireland. I work closely with young women who use drugs and trying to document their experiences and running events where they can come and share their challenges they face as young women who use drugs, but also as sex workers and mothers. In the global north and south, young women who use drugs are affected by punitive drug policies and face unique age-related and gender-specific risks and barriers and rights violations that are not well recognized or responded to by policymakers or service providers. Age restriction and required parental consent is an issue as it is for all young people who use drugs in general, but in terms of young women who use drugs, you face also significant sexual reproductive health challenges. Further, the minimum age of consent to medical treatment is inconsistent with the minimum age of criminal responsibility, demonstrating discrepancies in law and practices. In a side event I attended yesterday, young women involved in drug trade and production spoke about how severe the impact of prison has on them. Their inability to access IDs and certificates after serving their sentence, and therefore severe lack of access to services, as if this isn't already an issue before you go to prison. Young women who use drugs can receive a life-altering criminal sentence and be restricted in accessing assistance and resources to manage their drug use, at the same time as not being able to access these services because of their age. The issue of confidentiality is even more so an issue for young women who use drugs, as the stigma and discrimination for being a young woman who uses drugs is worse than those of men, which is something I've also experienced in my life, living in both the global north and global south. Most women who use drugs begin using drugs at a young age, which significantly heightens the risk of overdose and contracting infectious diseases. Young women who use drugs not being able to access tailored harm reduction services and information about safer drug use. Harm reduction services must have a gender and age balance so the young women who use drugs can discuss their challenges confidently and in a safe space. Young women who use drugs often face sexual harassment and violence, often by law enforcement, something I've documented recently when working with a young woman who uses drugs sex worker and talking about the challenges she faces here in Uganda. I'm also writing a paper for our Young People and Harm Reduction special series that we have as Youth Rise in the Harm Reduction Journal right now, with a number of other authors living in the Global South, about harm reduction services in the Global South and challenges faced in accessing them by young people. When there are harm reduction services, such as opioid substitution therapy, or MAT, methadone assisted therapy, depends where you are, they are inaccessible for young people due to age restrictions, as already mentioned, but also due to the timing of these interventions. Young women who use drugs, who already face socioeconomic challenges, cannot be expected to pay for their transport to and from clinics for services. And in the case of being a mother, how are they to travel to and from these clinics for services with no support for children?
These age and gender-related factors play hugely into the inaccessibility of harm reduction services for young women who use drugs in the Global South particularly, and my panelists will now detail these challenges that I've already mentioned. Thank you.
Thanks so much, Ruby. I think that was a fantastic overview to kind of lead us into the overall perspective of this discussion, is that the community of people who use drugs and of young people who use drugs is just as diverse as the general population. And we have different needs based on age, gender, and also social factors. So I think that was very helpful to get us started. And with that, I'm delighted to introduce our next speaker, Elish. Elish Berman is an activist, advocate, and trans woman who uses drugs. She is currently Youth Rise's executive director and focuses her work on full spectrum harm reduction, as well as how drug use and drug policies intersect with queer identities. Today, Elish will talk about and address the challenges at the intersection of being part of the community of both trans women and people who use drugs. Elish, on to you.
Yes, thank you, Trixie, and thank you to everyone for joining our side event today. Before I start, I would like to extend my love and solidarity to our friends and colleagues in Ukraine, and in particular, the trans and drug using communities in Ukraine. The situation for my community, trans women in Ukraine and at the border crossings, is extremely worrying. We need to see action from all parties to ensure the safe passage of key population groups out of Ukraine and all war zones, while ensuring we maintain their access to healthcare and other essential services. While the situation for my community, the root causes of stigma, discrimination, and transphobic policies are the same. As Trixie mentioned, I'm a young transgender woman who uses drugs. These two components of my identity, being trans and using drugs, are not distinct from one another and interact with each other in a multitude of ways. My trans identity is inherently connected to my drug use and impacts why I use drugs, when I use drugs, and where I use drugs. Drug use has provided me with freedom and space to explore my gender identity. And people who use drugs were among the first to embrace me and accept me as a trans woman. In this way, drug use and the drug using community provided me with something general society often could not: love and acceptance. It is this lack of acceptance from wider society that further impacts my drug use in negative and harmful ways. The trauma of being attacked in the street has led to an increase in the amount of drugs I use by way of self-medication. It has led me to use drugs more on my own, isolating myself from my community and the support and solidarity that comes with that, an issue which was further exacerbated by the pandemic. It has led to me engaging in more unsafe drug using habits, consuming more drugs and engaging in polydrug use, as well as avoiding what few services are available to me to meet my needs as both a trans woman and a young person who uses drugs. The stigma and discrimination from wider society is often manifested when dealing with public health and law enforcement professionals. Healthcare professionals are often unsuited to meet my needs as a trans woman, lacking knowledge of our experiences and medical needs, as well as often disregarding the information that I do provide to them. I'm unable to disclose my drug use to them for fear of losing access to essential trans-specific healthcare, such as hormone replacement treatment and surgeries. My experiences with law enforcement have been far from positive. Gender sensitivity among law enforcement is usually quite low, and they demonstrate little sympathy towards trans people or people who use drugs. This, combined with the gender marker in my passport, delineates that I would go to a male prison if arrested, the result of which would be catastrophic for my well-being. When I'm the victim of transphobic harassment or assault, it is often suggested that I should call the police. This is an almost laughable suggestion. The idea that I, as a trans woman who uses drugs, or even just a person with either of these two identities, would be safer in the presence of a police officer is very far from the reality that I and other trans people have faced and the track record of law enforcement. Despite all of this, I can consider myself to be quite privileged. I'm lucky enough to have a stable income and relatively affordable housing and healthcare. I'm in a position to speak with you here today and act as a voice for my community, many of whom are not so privileged as me. I'm white and I live in a country where my gender identity or sexual orientation are not criminalized. And I'm thankful that the gender marker on my passport, being different to my gender identity, does not have any significant impact on my daily life. The same cannot be said for my community in many parts of the world. My community, from me sitting here today, to the trans people we now see in popular media, or even sitting in parliaments around the world, all the way to the trans women trapped inside a war zone or facing violence on a daily basis around the world. We need to see a society free of stigma and discrimination, a goal which is unattainable through the scope of work of the commission we are all attending. However, within the scope of the commission and within the scope of the policymakers attending this commission, there are avenues for positive change. We know that easily accessible and gender sensitive harm reduction services have a positive impact on the health and well-being of my community. Similarly, we know the policies which allow trans people autonomy over their bodies and access to life-saving trans-related healthcare are extremely effective in improving the health and well-being of my community. We know that if we end the criminalization of people who use drugs and the LGBTQ+ community, this will improve the health and well-being of my communities. Despite the evidence towards these policies, government and policymakers who dictate our lives are reluctant to offer us even the slightest of change. In many countries, we're even seeing positive steps being undone in this regard, to the massive detriment of my community. We can see the evidence, in particular in relation to the global target to end AIDS by 2030, that these policies are effective. However, there remains a reluctance, at least in part, because some people simply do not want to allow my community to thrive. I will end by paraphrasing a well-known trans activist, Marsha P. Johnson, in saying that there is no pride for some of us without liberation for all of us. And that includes the most marginalized communities of both trans people and people who use drugs. Thank you.
Thank you very much, Elish, for that very powerful presentation. It was about time that Marsha P. Johnson was quoted at the CND. So thank you for that also. But I think we can all agree that you gave a very, very powerful and very personal statement on the intersection of these issues. And I think what you were also touching on very clearly is kind of this question of autonomy, which I think is going to come up quite a lot later on in this session as we continue to discuss these intersecting issues affecting young women and all of our diversity. So with that, I would like to hand over to our next panelist, Rita. Rita Gitonye is a woman who uses drugs, a harm reductionist, and a law student in Kenya. She is involved with a number of organizations. She is the coordinator of Women in Response to HIV/AIDS and Drug Addiction. She works with Vocal Kenya and the SSDP Kenya chapter also. Today, Rita will present us with the perspective of young women who use drugs in Africa, with a particular focus on sexual and reproductive health. Rita.
Thank you, Trixie, and thank you, Elish, for just packing a punch into how we should move on with this. I hope I'm audible. Connection here is okay, good. Okay, so like Beatrix said, my name is Rita. I am a woman who uses drugs in Kenya. I started using drugs at a young age, and my experience of drug use has largely been problematic. I come from a background where the social climate is very conservative. It is a background that criminalizes drug use and that buries their heads in the sand when it comes to sexual and reproductive health and rights. Just to give a little background, we had the Nairobi Summit on population and development, international context on population and development in 2019, where very nice commitments were made about emphasizing on the most vulnerable and disadvantaged people, empowerment of women and girls, including their right to sexual and reproductive health.
However, in the background of that, it has been said that Africa has a lack of attention, general lack of attention and a commitment of resources to sexual and reproductive health, that sexual and reproductive health has become sort of a token topic for governments to commit to and speak in a flowery manner about, but not act. My country specifically has the third highest rate of teen pregnancies globally, with 82 out of every 1,000 births being from adolescent girls. And every time a reproductive healthcare bill comes up, it is rejected on grounds of abortion or something is picked out. How does this affect women who use drugs, young women who use drugs specifically? It affects them in that the SRHR services and education that does not reach them, even in a bigger way, does not reach women who use drugs. I will give you a few examples. We have high defaulter rates among women who are in harm reduction services because of the insufficiency of these services and gender sensitive considerations. And like I said earlier, most of the drug use among young women here is actually problematic. And this is as a result of these gaps. As was said earlier by Ruby and the position paper, women who use drugs under the age of 18 cannot access harm reduction services, including HIV testing or SRH services without a guardian. This means that most of them shy off from the services because they will not go and and ask their guardians to come with them because of the criminalization of drug use. Something else is that young women are at a higher risk of gender-based violence. A lot of the cases we get are from young women of the age of 15 to 20 and unplanned pregnancies. Drug use has also been used to justify violations such as rape, and that is something that's a reality for young women who use drugs in all of Africa. When it comes to pregnancy, doctors will mostly focus on the aspects of drug use, so the stigma will keep the young women away. And even when they do go, there's limited access to these services, limited access to testing, limited knowledge of the body of the reproductive health system. So even where services are available, they are ineffective because the knowledge of discovered when lots of clinics and lots of clinical services could have been done but have not. So apart from the stigma, and sorry, just a second, doctors have, I'm going through my slides. So doctors do not provide comprehensive care, as we've said, because of the exaggerated focus on drug use during pregnancy as opposed to the person. This is mostly the case for young women. The fear of losing children, especially for young women who have left families back home, keeps them from accessing sexual and reproductive health. The cervical cancer services that we have in Africa are very limited, and even when they're available, they are scant and they're mostly from donor sources. So our countries have not invested in this. Drug use and sexuality is a topic that is as taboo as they come in my part of the continent. There's little, if any, information available for young women who use drugs on how different drugs may interact with different aspects of their sexuality. For example, if stimulants can cause dehydration and lead to higher risks of infection. There is no information on that. There is no information on the risks of sex work and drug use, especially for young women who are considered as being trafficked and not able to sell sex, so they are left behind by interventions. Young women are not equipped with negotiation skills or refusal skills that are necessary for sex work. When it comes to fertility as well, there is no information for young women about drug use and possible considerations of fertility. And even when there is information, it's vague. It's not something that the young woman can then use as a life skill. Young women who use drugs in Africa are also not aware that sexual and reproductive rights are an actual right. The right to control their fertility, the right to have children or not. So they are bound to fall back to the gender norms that place young women in the position of having to take care of others and just focus on childbirth and not be allowed to use drugs. We all know that HIV prevalence is higher among young women who use drugs than in men who use drugs. So in conclusion, I would like to just say that it is completely irrational to talk about public health care without paying full attention to the sexual and reproductive health and rights of the marginalized populations, which in this case is young women who use drugs. The problems facing young women who use drugs are the problems that, if unchecked, will become the problems facing all women who use drugs. And then they become the problems that face the children of all people who use drugs. So sexual reproductive health as an intervention cannot be gainsaid. Investment in sexual reproductive health for young women who use drugs can go a long way as well in preventing recreational drug use from either becoming problematic or remaining problematic. So the recommendations obviously would be to take SRH seriously as a minimum package of harm reduction in every harm reduction center, and not just the little tokens here and there that really leave young women who use drugs underserved. It would be a disservice to the civilization of Africa, to the civilization of the world, not to look at sexual and reproductive health services for young women who use drugs. So with that, I would like to just echo what my colleagues have said and just, yeah, that is my experience.
Thank you very much for sharing that, Rita. I think that was extremely important. And you were also touching on it that we have already brought up in the context of decriminalization, that legal regulation that seeks to protect people from harms can often lead to endangering people more. And that's very relevant in the context of sexual and reproductive health as well. As you mentioned, age of consent laws, and like medical consent regulations. I think those were very, very important points to bring into the discussion today, as well as, you know, touching on the access to information, which I believe Mariaba is also going to touch on a little bit. So I would like to introduce our next speaker, Mariaba. Mariaba Quesada is an Afro-Latina anthropologist from Costa Rica, specialized in cultural management and multimedia communication. She is the co-director of Latin America for Sensible Drug Policy, and she is an international working group member of Youth Rise. And today she will talk about the systemic violence against women who use drugs, but also focus on addressing the harms of the lack of data that we have available on women's realities. Mariaba, you have the floor.
Thank you so much, Trixie, for that introduction. I am more than excited to be here today, and I hope that we'll have good time checking out what I have to say for this panel. I'm going to share the screen. Let me see if I'm able to do so. I cannot do it, so if the host could let me, that would be great. Great, thank you. Okay, let me know if you can see my screen, please. Okay. Okay, today I'm going to talk, as Trixie said, about systemic violence against women who use drugs. And of course, we're going to dive in a little bit into other forms of violence that Ruby already discussed, is the fact of the lack of data, or including the misinformation around young women who use drugs. Okay. Firstly, I would like to talk about the concept of systemic violence against women in general. Before we dive into the discussion around young women who use drugs, I believe that it's important to take into consideration the challenges that Latin American women have been experiencing throughout their lives, even if they are drug users or not. The Commission, the Commission has identified a series of problems around young women who don't use drugs, in the region, facing particular situations around discrimination. So the idea is to prioritize the lines of action to promote and ensure the fundamental rights. As you can see in the presentation, a series of factors are related to the way in which systems of hatred and discrimination against women are established around the globe. The Inter-American Commission on Human Rights established during 2019 a series of challenges and advances in order to eradicate all forms of violence experienced by women and girls in Latin America and the Caribbean. But women in the region continue to face serious challenges when it comes to having their fundamental rights fully respected and protected in the context of violence and structural endemic discrimination against them specifically. The main problems that have been reported rely on gender-based killings, harassment, sexual violence, and even obstacles to access to a correct justice system where they're facing situations of violence. It is also important to emphasize that factors such as race and ethnicity play a preponderant role in the experiences of violence and discrimination in the lives of Latin American women and indigenous women too. This is reflected in the Article 9 of the Convention of Belém do Pará, which sets the states of obligation to take in special account in the vulnerability of women to violence by reasons of race and ethnic background or their status as migrants, refugees, or displaced persons, in adopting measures to prevent, punish, and eradicate any forms of violence against them. Despite the contents, agreements, and conventions, the life of Latin American women, adolescents, and girls are continuing to be at risk. Prioritizing forms of violence as problems that we have to take into account right now, it's a fundamental step in giving space into this discussion. However, it is possible to recognize that women's experiences are far from the proposed objectives that sometimes we see or we planned in a more like paper-based. Now that I share with you this brief introduction, I think it's proper to start talking about like the correlation between violence against women and our decision to use drugs. Let me just put down this one. Okay. Well, the Latin American women's movement has expressed concern about the impacts of the war on drugs on women all over the region. In the declaration, revision of the current anti-drug policy, a priority for reducing violence against women in the Americas, it argues that the structural violence faced by women has increased and intensified in the context of the conflicts generated by legal markets. In this context, cruelty against women has symbolic connotations marked by the exacerbation of stereotypes and violent masculinities. Current anti-drug policies generate spaces of illegal ability that also give a free hand to the other illicit activities that could be related to drug trafficking, like human trafficking, on which women are the main victims. The justice systems in the region have had enormous difficulties in developing an effective strategy against these organized crime ideas. Prosecution efforts have ended up concentrating on the least responsible actors in the trafficking chain, which are poor women or children, women with who are small-scale dealers, women used as couriers, and young women who use drugs. In the production and transit zones, most which are located in developed countries, there are most serious effects of this crusade. The living conditions of the poorest populations are further deteriorated, and actions such as militarization, displacement, or fumigation plans are implemented, among others. This leads to negative consequences. The prohibition is part of, a beyond negative consequence, but it's like a domino effect who led another consequences that are part of a policy that has led to the accumulation of wealth by those associated with the illegal markets. With the excuse of protecting citizens, democracy, and the political system, the state itself breaks the structure of guarantees and rights. I put this quote that I really liked that says, beyond its rhetoric, prohibition is not put into practice in a coherent way and has an ambiguous and inconsistent aspects. It punishes and persecutes relentlessly some participants of the illicit drug market and tolerates others. Now I would like to talk about incarceration, women, and drug trafficking. I think that it has been kind of clear that I'm focusing on Latin American women, but if it's not clear enough, I'm going to focus more on this part because there are a lot of like things in common that we have, but there are also a lot of differences. Okay. Well, according to the report, Women and Drugs in the Americas, a policy working paper that it was launched by the Inter-American Commission of Women in 2014, the majority of studies conducted to date with female prison populations in the region indicate that a high percentage of women prisoners in the Americas are serving sentences for nonviolent drug-related offenses, which in most cases are a direct result of poverty or lack of other opportunities for women who have suffered violence and coercion by their partners or other men or even like other people around them. They have been victims of violence way before going to the illegal market. Globally, more than 500,000 women and girls are held in prisons, serving sentences and awaiting for trial. It's around 10% of the women population incarcerated. In addition to potential separation from their families, abandonment by their partners, and loss of poverty, women prisoners face disproportionate levels of social stigma. Women who commit crimes, even if they are nonviolent and motivated by economic need or violence or coercion, are seen as violators of fundamental social and gender norms that prescribe certain types of behavior that are appropriate for women. So the fact that they're committing a crime is seen weighing 2 or 3 times worse that it could be seen as if a man do the same action. Now I'm going to share with you real quick few data about how it's going on in Latin America when we talk about incarcerated women right now. In the case of Argentina, 65% of the female prison population is incarcerated for drug-related offenses. That is approximately 790 Argentine women. It's also important to say that in Argentina, women who commit drug-related offenses are often subject to prolonged periods of pretrial detention, which increases the number of women in prison. In the case of Brazil, we also have that a study of federal prisons for women says that in 2011 indicates that an average of 60% of the total federal prison population is due to drug trafficking right now. In the case of Bolivia, we know that the last report of the Inter-American Court of Human Rights states that 48% of the Bolivian women in prison are deprived of their liberty for drug-related crimes. The case of Bolivia, it's kind of interesting because they have passed the law 1008 on 1988, which is the law of the Coca and Controlled Substances Regime. It was pushed under the strong pressure from the reverse government at that time. And this decision severely punishes the cultivation of more than 12,000 hectares of coca leaves. As a result of this law, the living conditions of indigenous populations, peasant women, and families historically responsible for coca leaves cultivation in the country have become even more vulnerable than they were before. In the case of Chile, currently 1,317 Chilean women are incarcerated. That is around 16% of them who have committed drug-related crimes. In the case of Ecuador, 80% of the Ecuadorian women are convicted or charged with various drug-related crimes based on the census of female prisoners on 2008. And in the case of Mexico, the Centro de Investigación y Docencia Económicas, which is the CIDE, conducted a quantitative and qualitative research that estimates in 8 Mexican prisons that 80% of the female prison population was incarcerated for drug-related offenses. We have to also say that 92% of those women incarcerated for those crimes had committed those situations without weapons and in a non-violent manner. And last but not least, in the case of my country, Costa Rica, according to a 2012 study of the National Women's Institution, which is the INAMO, 65% of the 780 women currently are incarcerated for drug-related drug-related crimes are convicted right now. Before I end up my panel, I would like to end up with this question, which is basically quoting the words of Ruby when we started the panel, can a lack of information be a form of violence against women who use drugs? Well, going back to Ruby's words, the lack of data and scientific-based information around the effects, scenarios, and social interactions around women who use drugs is one of the main reasons why the Women Who Use Drugs position paper was even made. Within the scientific and academic discussions developed around drug use, there are forms of violence that women experience directly, as they are not taken into account in the research associated with harm reduction, or do not have a safe spaces for participation in the analysis of their experience. On the other hand, male views dominate the field of academic proposals. So is it possible to say that the lack of access or opportunities for women researchers to promote their own theories translates into a form of violence, even with the discussions of drug use? I would like to end my panel with the words of the philosopher and literary theorist George Steiner, who developed a theory of what is not named does not exist. It is necessary to name women in an integral way, taking into account the realities, experiences, and way of living harm reduction. This perspective will tell us a totally different way of looking at drug use. Thank you.
Thank you very much, Marielba. That was, again, a very powerful quote. And also your entire presentation, I think, really highlighted there's multiple levels of violence and harm that women face, not just when using drugs, but at all points of the drug trade as well, and in all areas of life, basically, and how all of these harms add on to each other and exacerbate the situation. So thank you very much for your presentation. And hopefully to give us a little bit of a more cheerful perspective, or at least some ideas on how to overcome these challenges. Our next speaker is Carolina. Carolina Ahmada is a sociologist from Argentina. She is currently project manager at Youth Rise and the coordinator of PUF, a harm reduction program for young people in nightlife. And today she will talk about the importance of access to harm reduction and services, and how these can be adapted to be friendly to young women in all of their diversity. Carolina, you have the floor.
Thank you. Good morning, good afternoon, everyone. It's a pleasure to be here with these amazing young women and everyone here in the panel also. I'm going to speak today about the importance of assessing harm reduction services for young people who use drugs, and what can we do as service providers to tailor our programs for young women. I have been working at a harm reduction project for young people in nightlife in Argentina for the past 5 years and became its full-time coordinator last year. Young women are among the most likely to make use of harm reduction services wherever they are available, and are also the most willing to discard or put out or take in substances that prove to be adulterated or unknown purity and quality. Drug checking is accordingly a very effective harm reduction approach for young women who use drugs in nightlife and festival contexts. It is highly recommended to provide drug sample field testing services in such contexts to help young women make more informed choices about their substance use. As we claimed in the position paper last year, while harm reduction has proven effective in improving health goals among people who use drugs, current programs are generally not designed to respond to the needs of young women or the specific legal challenges and ethical concerns in working with them. Oh, sorry, my screen got black at some point. Sorry, this is mainly because young women are underrepresented, as we have been speaking for the past 40 minutes. They are unrepresented in health research on drug use, which leads to their specific needs going unrecognized or not being well understood by medical professionals, service providers, and policymakers as well. For example, what happens when women use drugs and take birth control pills, or how drug use may impact in our periods? Even though this gap is not well documented, young women and adolescent girls interact with drugs in multiple contexts and face all the same risks and challenges that adults who use drugs, only exacerbated by age and gender-related factors. Research and clinical experience has shown that women and girls respond well to programs that are women-centered and feature meaningful involvement of women who use drugs, while in populations of young women, there is evidence of a greater efficiency or of programs that are peer-led or involve peer support. It is also imperative for this matter, that the staffing structure of harm reduction services strive for a gender and age balance, as young women may feel better able to discuss their drug use with their peer young women. This is especially important in instances when young women report experiencing sexual harassment and violence in context, as women's drug use is often used to justify, minimize, or normalize the violence they face. An effective action for interventions in nightlife, for example, is putting posters in bathrooms with anti-harassment messages and also consent. Finally, I'm going to read a couple of recommendations that we put up in the position paper that we made last year. So the recommendations are: end the criminalizations of drug use, institute strength-based client-led support programs for young women who use drugs in need to replace punitive approaches to drug use, remove policies and laws related on age restrictions that affect access to harm reduction services and commodities, health and healthcare, remove parental consent requirements on healthcare services, including SRH services, and establish effective confidentiality warranties. This is very important because when we talk about sex health, it's very important that we are in a very comfortable environment, especially for young women and girls. Promote gender equality and gender transformative programs in harm reduction. Increase the use of alternatives to imprisonment in line with the Bangkok rules. Expand provision of youth-friendly, gender-sensitive harm reduction services for women who use drugs, incorporating comprehensive SRHR, GBB, and counseling services tuned to the needs of young women. Ensure the capacity of harm reduction staff and other healthcare workers to provide youth and gender-friendly services. Support community-based organizations that are inclusive of young women who use drugs. Support youth-led organizations to produce advocacy and action research, highlighting the needs, priorities, and voices of young women who use drugs. And create frameworks for acknowledging young women under the age of 18 who use drugs and are involved in the sex industry to recognize and protect their rights and needs. And finally, but not least, support widespread drug testing to enable safer use. That's all for me. Thank you very much.
Thank you very much, Carolina, for leaving us with those recommendations. I think it's very important. I do want to say that our allocated time is up, and some of you might need to run to another side event, but we would be happy to stay on for a little bit and either answer some questions that you might have or just chat if you feel up to it. I didn't see any questions in the chat, but thank you for everybody for joining us, and for the very supportive comments in the chat. I think it's been great to see those come in. But yeah, with that, I would like to thank our panelists once more, who were all fantastic, I believe. Ruby apologizes, she had to go to another side event. And yeah, if anybody has any questions or comments, I'm happy to open up the floor. I think you can just unmute yourselves. Or any additional comments from the panelists if you want to make any.
No, maybe I just share my screen because I wanted to share a poster that we put on bathrooms that was speaking before. Maybe let me just check if I can do this. Or maybe not. I don't know. Well, never mind, because I can find it right now. So no worries. I'm gonna send it to you after all.
Well, then I would just like to thank everyone who joined us. I think that as many comments here said, it was a pretty powerful panel. There was a lot of information and a lot of things that we can reflect on how we perceive and understand young women who use drugs. which, as we said at the beginning of this panel, it is important to have this kind of options available in this big discussions that are so important. So thanks again, everyone, for joining, and thank you, Trixie, for this space. It was really good.
Yeah, thank you very much, everyone. I think this was fantastic. I'm really happy that we were able to put this on. Obviously, this is not a topic that is often being discussed at the Commission on Narcotic Drugs. So thank you very much. I see people are leaving now, so I think we're gonna wrap it up. But if anybody has any questions, you can get in touch with us through YouthRise, the general YouthRise email address that is also included in the position paper that I'm gonna link once more, just in case. And yeah, we're happy to answer any questions. And also that, yeah, thank you, Elish. That's way more helpful. Yeah, all right. Yeah, I think I'm gonna wrap up with that. And thank you all once again for coming. It was great to see so many people interested in what we had to say today. So yeah. Thank you very much and have a great rest of your CND.
Bye.
Thank you, everyone.
Thank you.